Administrator Rag Beckarian felt confident, he said, that they were taking the right precautions at GEM Transitional Care Center before the coronavirus struck. The 4-star rated nursing home on South Fair Oaks Avenue in Pasadena had closed its doors to visitors a week before the state's guidance. Managers held frequent training sessions, screened all entrants and ramped up hand-washing checks. "We believe we were well prepared," said Beckarian, 31. Southern California nursing homes during the coronavirus pandemic. Latest installments in a continuing series. The series was produced by correspondent Brenda Gazzar and SCNG staff writer Beau Yarbrough, participating in the USC Annenberg Center for Health Journalism's California Fellowship. Yet since mid-April, nearly 55 residents at GEM Transitional tested positive for COVID, more than a dozen of whom died. With typically around 65 daily residents, the nursing home has one of the highest COVID-related resident death rates in Los Angeles County for its population, according to a review by the Southern California News Group. About 4 miles up the road is Camellia Gardens Care Center. As a 1-star facility, it has the lowest possible overall rating on Medicare's Nursing Home Compare. The slightly larger home had 3 residents contract COVID and only 1 death, said Nelida Arlante, the home's administrator. Arlante believes their vigilance helped curb the virus there. As a former physician in the Philippines, Arlante said, she may have had an edge. More than 2,900 nursing home residents have died of COVID-19 related causes in Los Angeles, Orange, Riverside and San Bernardino counties, comprising about 1/3 of this region's total coronavirus deaths, according to data from the California Department of Public Health. Nursing homes across the region have touted early studies showing that location and size largely determine how they've fared with the virus. But it's becoming increasingly clear that several other factors can help seal a home's fate. Mass testing with quick results and adequate personal protective equipment are clearly important, experts say. Nursing staff levels, infection control practices, resident demographics, leadership and even a home's for-profit status also can contribute to the death toll. "It's all those factors," said Charlene Harrington, professor emerita at UC San Francisco and a registered nurse. Beckarian believes the high death toll at his for-profit facility is due at least partly to the type of residents it serves. "We take high-acuity patients," said Beckarian, whose GEM Transitional facility often accepts patients from neighboring Huntington Hospital. "We had residents in the building that had higher and severe chronic conditions. People of color, who are disproportionately affected by the virus, also made up nearly 60% of their residents, according to data Beckarian provided.